Hi, my name is Dr. Chad Watkins with Watkins Foot and Ankle Clinic located in Leesburg, Florida. And today I wanted to talk about a common condition which will affect many elderly adults, and that is arthritis or spurring in the middle of the foot. It is very common to develop arthritis in the middle of the foot or on the top of the foot due to the cartilage wearing away over time. You're only born with a certain amount of cartilage, and over time the cartilage will wear away. So the joint that I'm talking about is called Lisfranc's joint, and it involves the metatarsal and the cuneiform joints on the inside of the foot and the metatarsals and the cuboid joint on the outside of the foot. Now, it's much less common for you to develop arthritis around the metatarsal cuboid joint, but it's very common to develop arthritis around the metatarsal cuneiform joints. And the most common bone involved is the second metatarsal and the middle cuneiform joint. So, as we are born, we have a certain amount of cartilage, and basically cartilage cannot heal itself. So bone can heal itself, tendon can heal itself, nerves can heal themselves, but cartilage is unable to heal itself. So you're born with a certain amount of cartilage, and over time it gets worn away. And as it gets worn away, the bones get closer and closer together. And as the bones get closer together, it can bend and it can jam and it can start to cause a spur on the top of the bone. So what we have here is a drawing that basically demonstrates the second metatarsal and the cuneiform joint. And so this is the model, and this shows the second metatarsal cuneiform joint. And so what I was attempting to show is basically the black dotted lines is the cartilage between the bones. And so as it wears away, it will become narrower. And as it becomes narrower, as in the top picture, you'll start to have the top of the bone hitting against the top of this bone, as basically the pressure from the bottom of the foot gets pushed on the metatarsal head. It then pushes up, and this spins back and causes jamming. And so the spur forms on the top of the bone. And so you'll have a bump on the top of the foot, and there's a nerve that basically runs right over the bump between the second and third metatarsals and the cuneiforms. And so as your shoe pushes down on the skin, due to the tight shoelaces, things of that nature, it will cause pain around the nerve. And so it'll be a sharp, shooting, burning pain down the foot. And so what you look at is often we'll look at surgery to shave the spur off and remove the spur. Now that does nothing for the underlying arthritis. In order to address the arthritis, we would have to actually fuse the joints. But the problem with fusing the joint is if you take away motion in this area, you increase motion in that area. And so what will happen is if you were to fuse basically the second metatarsal cuneiform joint, you'll increase pressure on basically the naviculo-cuneiform joint. And so when you fuse the bone, it then transmits the stress up onto this joint, and so you'll trade off pain now for pain later on around the area. So it is one thing to just shave the spur on the top of the foot, and with that we just make an incision along the top of the foot, go down, pull the nerve and the artery out of the way, and then shave the spur off around the joint, but leave the joint in place. So what I tell people is you have to recognize the difference between attempting to address the arthritis, which is a fusion, and it means 2 months in a cast off of your foot, no weight whatsoever, and then a month in a walking cast, and it's about a 3 to 6 month recovery, or shaving the spur, and all you're doing there is trying to get rid of the jamming on the top of the foot where the bones bend back and jam together, or the aggravation of the nerve where it causes a neuritis or inflammation of the nerve. Now, to calm down the nerve, we can try cortisone shots, physical therapy, oral steroids, but often due to the jamming, you'll have to do surgery to shave the spur down, but it's important to recognize it will do nothing for the underlying arthritis. Now, other simple conservative measures are just loosening the shoelaces through the area so that the straps don't rub or aggravate the top of the foot. So if you're having any type of pain in the middle of your foot, or if you think you have arthritis, or you notice a bump on the top of your foot, similar to on the top of my hand, there'll be this lump sticking out on the top of your foot. That's what the spur looks like, okay? And it's basically just the jamming of the bones together. I tell people it's like a bulldozer, backing up, pushing forward, backing up, pushing forward. The pile of dirt gets bigger and bigger and bigger. So the spur will get bigger and bigger and bigger, and eventually it'll start getting aggravated by the shoe gear or aggravating the nerve or causing inflammation around the joint. So once again, if you're having any problems in the middle of your foot, you think you have arthritis, you think you might have a spur, you've got this lump on the top of your foot, come on in, see us at Watkins Foot and Ankle Clinic in Leesburg, Florida, 352-805-4317.